So I think that there's a lot of potential applications, and one really obvious one is, for example, diabetic retinopathy. Diabetic retinopathy is characterized by changes in the vasculature that cause what we call capillary dropout or impaired capillary perfusion. And that's exactly what OCT angiography or AngioPlex is going to allow us to look at now, because we can see exactly where there is blood flow and where there is not blood flow. And by doing that, you can actually evaluate the patient really for a success of at least some treatments and the appropriateness of some treatments. So I'll give you one example. A lot of times we'll have patients come in with decreased vision and diabetic retinopathy, and we won't know if that's because there's macular ischemia, which is lack of blood flow in the retina, in the macula, or if there's edema. So what we'll do is a fluorescein angiogram and an OCT. Well, now when we have OCT angiography and AngioPlex, we can easily see the extent of the macular non-perfusion or the macular ischemia. And sometimes if we know that there's macular ischemia, it'll affect the way that we decide whether to do an injection, whether to follow a patient more closely, or whether to just tell them, look, we're going to try to do this treatment and it may not improve your vision as much because there's not enough blood flow there to support the visual function that we know you need. So there's a couple of different examples where people are using OCT angiography to change the management of their patients. So for example, in macular telangiectasia, one of our colleagues, Dr. Rosenfeld, has really been looking at the ability to visualize whether there is choroidal neovascularization or not in this disease. And it turns out that particular feature of the disease is kind of hard to tell on fluorescein angiography and clinically. So using OCT angiography, oftentimes you can see the choroidal neovascularization very clearly, and he's published a couple of papers about this. And if there is choroidal neovascularization, then we're really in a good position to recommend a treatment such as an injection of an anti-VEGF agent to help stop the growth of those choroidal neovascular vessels. So another example of where we can use AngioPlex to look at retinal vascular diseases is retinal venous occlusions. Oftentimes patients with retinal vein occlusions will have an occluded vein that results in intraretinal hemorrhages and intraretinal edema, as well as macular ischemia. On fluorescein angiography, we need to do it repeatedly to be able to see where the macular ischemia is. But with OCT angiography, it'll be easy to follow the macular ischemia more regularly to see if the injections are improving or not improving the macular ischemia. And that's actually an important question in the field now, because we're not able to measure that as carefully as we'd like to.